So can you see my slides?
Yes.
Thank you. So I will talk about the topic about how to manage patients with longitudinal melanonychia tonight. So I'm a dermatologist surgeon coming from Department of Dermatology, National Taiwan University Hospital. Melanonychia, the definition is a brown or black discoloration of the nail. The term describes the color, but does not include the pigment. So talking about melanonychia is a very worrisome problem for patients. They will think about melanoma and they think about every kind of possibilities. So the cause of melanonychia may be from endogenous melanin. It's could possible.
Here is another example. Pigmented band situated laterally. Its color is rather cloudy and the border is blurred. Hyperkeratosis or dyskeratosis is not prominent in this case because this is in the early stage of the disease, as the pigmented band looks tapering triangle. You can see here the surgical specimen and the pathology. Nail plate is pigmented from the beginning to the end, very similar to melanoma. But looking at the pathology, nail bed is filled with disordered keratinocyte. These two low and middle power slides represent the epithelial cell movement and formation of oblique line.
Hi everyone, my name is Byung Ho Oh from Yonsei University, working in Severance Hospital, Seoul, Korea. Thank you for inviting me as a presenter in South Asia. My topic is my experiences of my nail surgery. Nail complex consists of nail plate, nail bed, nail matrix, proximal, lateral, and distal glues, proximal, lateral fold, and hyponychium. Functions of nail complex are aesthetically appealing, protection, precise, delicate movement through the mechanistic action of counter pressure exerted over the volar skin and pulp.
Thank you very much. So we have from Dr. Hao, is there a rough estimate of how many surgeries we saved by nail dermoscopy? Dr. Liao or Professor O'Hara, you may answer.
The dermoscopy, the differentiation with the dermoscopy, especially for the melanoma and the nail streaks, is sometimes very difficult because the nail streaks in the infancy changes their clinical aspect. Initially, it is very clear, or as Dr. Liao presented, the so-called Hutchinson signs is very, very often seen in the nail streaks on the children. And many dermatologists or even the family very nervous about this phenomenon. But I always talk to them that it is just a pigmentation. It will subside by itself, even if the skin is evolved. The so-called Hutchinson sign in the infantile nail streaks regress by itself. I have many cases. I have seen